Linda called my wife in tears because she had to cancel plans with her grandchildren. She promised to finally take them to the zoo. She could barely stand, let alone walk around the zoo all day trying to keep up with 2 kids. But you know, the heartbreaking disappointment on their little faces when Linda had to break her promise was just too much. And when Linda called my wife, she was practically sobbing. She said, "Your husband was a doctor. Can you please ask him if he's got any ideas? My life sucks. This isn't how I envisioned my retirement. I can't keep living like this." Well, by this point, her doctors were already recommending nerve blocks and surgery. But the out-of-pocket costs were just too high, and she was terrified of the potential risks. What if her nerve pain got worse? What if she lost muscle function or wound up feeling numb all the time? She wouldn't even be able to take care of herself, and she couldn't take that risk. But fortunately for Linda, I already had a pretty good idea about what was causing her pain and what she could do about it. And I discovered it years ago during my volunteer medical relief work in Sri Lanka. The older people there were hobbling around in excruciating pain. But when I examined them, their pain wasn't coming from the tsunami-related injuries. It was actually a severe nutrient deficiency causing their nerve pain. And research confirms what I saw. When your body lacks the right nutrients, it leads to painful nerve damage. But pain doesn't mean your nerves are damaged beyond repair. Far from it. Pain just means your nerves are still alive and capable of repairing themselves. Do you know that the Mayo Clinic even confirmed that your nerves can regrow up to 1 inch every month? But the catch is that they need the right nutrients to do it. And the solution isn't as simple as be eating healthy or take a vitamin. If we want our nerves to regrow, there's one specific nutrient they need that 50% of Americans are not getting enough of. And it's not just Americans. People all over the world aren't getting enough of it. And this nutrient is one very specific type of magnesium that's really hard to find. Now, I know that most multivitamins contain magnesium, and I know most supermarkets have magnesium supplements lining the shelves. But see, the problem is most types of magnesium won't do much of anything for nerve pain. That's because most magnesium supplements contain magnesium oxide, which is much harder for your body to absorb. So if you've already tried pills and multivitamins that didn't work, now you know why. Fortunately, there's a third option called transdermal absorption. And it's when your skin absorbs certain molecules if they're small enough. In a 2023 clinical trial, patients who applied a special form of magnesium called magnesium chloride to their skin had significantly reduced nerve pain. And their blood magnesium levels didn't change at all, which is exactly what you want. Something that skips the bloodstream altogether and goes straight to your nerves. So I went straight to my trusted pharmaceutical contacts to find a real solution for Linda. And the company my contact introduced me to was a company called High Relief. So I reached out and I said, "Can I get a sample of your nanomagnesium cream?" in exchange for me telling them whether or not it helped. They gave me way more than I needed, so I took the first jar, inspected the ingredients label, and then had my wife give a jar to Linda. So a few weeks later, my wife was practically pressing her phone into my face saying, "Linda wanted to talk to me. Is this Dr. Dave? I wanted to thank you so much for sending that cream. It's the first thing that ever worked for me." So that's when I realized if this cream worked for Linda, it probably worked for others too. So I started asking my wife if she knew anyone else with neuropathy. There were actually quite a few people on the block. So I started handing out the samples that I got, and just weeks later, I was floored when folks from all over the neighborhood were coming over to thank me, and the whole neighborhood was buzzing about it. That's when I knew I couldn't just keep this to myself. I needed to share it with as many people as possible. But first, what's actually in this cream, and what makes it work? Well, first off, it has nanomagnesium chloride, the type that's been shown to be effective for nerve pain. It's also got methyl sulfonyl methane, also called MSM. It's been shown to reduce inflammation in human clinical trials. And that's really important because studies from reputable peer-reviewed sources like the Journal of Neuroinflammation have shown that reducing inflammation can reduce neuropathy pain. And lastly, they've added arnica to help improve blood flow. Most people don't realize that their nerves actually need oxygen, and they get oxygen from blood. But the problem is neuropathy causes inflammation. Inflammation damages the walls of your blood vessels, which reduce the blood flow, which makes the problem worse over time. On top of that, your nerves also create waste products that need to be flushed out before they cause damage. And the only way your nerves can get rid of those waste products is with good flow. So, Based on my research, the ingredients makes perfect sense to me. Each one serves a specific purpose and has the science to back it up. And that's when I knew I had to get this solution out to as many people as possible, which is why I'm here right now. But the thing is, I'm a doctor, I'm not a sales rep. I'm just here to give you good information so you can make a smart, well-informed decision. So that's why I think it would be best to have an actual Total Relief user tell you all about the special deal she recently received from the company.